So you have some stress. No worries. That's what you're here for. We're going to talk about reducing stress for a healthy pregnancy. Now, you probably intuitively know that stress isn't great for your health. It's not great in pregnancy. But what does the data tell us about the impact of stress on pregnancy? By the way, hi, I'm Dr. Sterling. I have my degree in neuroscience from USC, where I graduated summa cum laude. I went to the Keck School of Medicine to get my medical degree. I'm a board certified obstetrician and gynecologist, fellow of the American College of Obstetrician and Gynecologists, and I'm the founder of Sterling Parents. I am here with you right now because it is my mission to, one, reduce your stress load, and two, support your development as a mom. Now, my why for wanting to reduce your stress load is in part because of the data that we're going to talk about in a second, but also because of my own high stress pregnancy and my daughter's subsequent health issues. That's where the fire and the passion comes from, because I have been where you are. And then my why for wanting to support your development as a mom is because there's a lot of pressure to be an incredible mom. I know that if you're here watching this video, you're probably a lot like me, and I want to be an incredible mom. You want to be an incredible mom, but when you have pressure without support, what it does is it really weighs us down, and it crushes us, right? So I want to be here to support your development as a mom. So let's talk about the data on pregnancy stress and pregnancy outcomes. So we know that stress in pregnancy is associated with an increased risk of blood pressure disorders such as preeclampsia, preterm birth, which means baby is born before it's done fully developing, before 37 weeks, and then low birth weight, which means that baby is small and potentially hasn't grown to their full potential in pregnancy. So we also have data that pregnancy-specific anxiety may be more closely associated with preterm birth than just general anxiety. So if you are someone who is at elevated risk for pregnancy complications, maybe you're advanced maternal age, you have a history of pregnancy complications, you have a high stress job, or maybe this is your first pregnancy, which actually first pregnancy is a risk factor for blood pressure disorders of pregnancy, but also it means that we don't have a normal healthy pregnancy in the past to reassure us that what your baseline risk is. So if you have some of these higher risk issues, we want to be really proactive. And the truth is that we want to be proactive, not just for our pregnancy outcomes, but because we know that stress impacts fetal development. And we know that exposure to stress can increase a child's risk of developing certain neuropsychiatric, cardiovascular, metabolic diseases later in life. As a mom who had a high stress pregnancy, there's actually a low risk pregnancy, but very high stress, this knowledge weighs very heavily on me. And it is the reason behind why I left my clinical practice and designed and created a membership to specifically reduce pregnancy stress. So I want you to know that this is a safe space. If you're here, you and I are probably very similar, and I'm not here to judge you, and I'm also not going to tell you to relax or not worry so much, okay? That is not helpful. Your concerns and worries are valid, and they deserve to be addressed. You have stress because you care. You worry because you care. My guess is that probably at your baseline, you're somebody who wants to do a good job. You want to do your best. When you add pregnancy into the mix and feeling like you need to protect your baby, that pressure just gets a lot higher. So I'm glad you're here. I understand you. I get you. So you've got this stress load. What do we do about it? So first, we really need to break stress down, okay? Stress is actually two separate but linked entities. One, there are stressors, which are things that cause us stress. Stress is actually the response our body has to the stressors. It's a neurophysiologic response in our body to stressors. Now, let's break that down even more. So stressors, the things that cause stress, can be inevitable, meaning that there's nothing that we can reasonably do to avoid them. Those are things like natural disasters, sexism, racism, anti-Semitism. we don't want those things to come into our life, right? They come regardless. So we don't have a lot of control over them coming into our life. Then there's avoidable stressors. There's something that can be reasonably done to avoid them, and thus they're avoidable. So this is a pearl of wisdom here. So if you remember nothing else from this class but this, I will be happy. Because we cannot control the stressors with inevitable stressors, we can't control them coming into our space. We manage the neurophysiologic response our body has, okay? But with avoidable stressors, we try to reduce them. We try to block them coming in and impacting our body, okay? What I'm going to talk about right now is reducing avoidable stress and really narrowing in, because my job is to help you avoid as much pregnancy-specific stress as possible. So, the assessment that you just took was really gauging your level of stress load in pregnancy. And these are just some of the common elements of the stress load of pregnancy. This is not an exhaustive list. There's a lot of other items there, okay? But worrying about symptoms, worrying about accidentally harming baby, birth worries, anxiety about your lab and ultrasound results, and then researching and trying to figure out the answers to a lot of your questions. Because when you feel stressed or anxious, researching and preparing is oftentimes helpful, right? But anytime you do that and you venture into the vast world of the internet, there's a lot of information overwhelm, conflicting answers, not sure who or what to trust. And then that leads to a lot of second guessing and worrying that you're missing something, okay? There's the stress of preparing for baby, the worry and pressure about being an incredible mom, and then, of course, the pressure to do everything right. When you're pregnant, you want to do everything right. When you're a mom, you want to do everything right because the stakes are high. So, isn't it curious that I know so many of the stressors, so many elements of your stress load, and yet, most likely, you and I have never had a one-on-one conversation? Interesting. Do you know what that means? Think about it. The pregnancy stress load is in large part predictable. I can predict what somebody who gets pregnant from a month from now is going to be worried about in a few months. Now, why are human beings so obsessed with predictions, right? We want to predict the weather. We want to predict the traffic. Why? We want to predict things because we want to be able to avoid an undesirable outcome, right? We want to avoid being caught out in a rainstorm in our flip-flops. We want to avoid leaving for our road trip and hitting a bunch of traffic. So the pregnancy stress load is predictable. And if we predict it, we can prevent it. So how? How do we do that? How can we prevent the pregnancy stress load? Well, I'm going to give you an example. So something super common is around 16 weeks of pregnancy, people start having questions about baby's movement. Typically in the first trimester, people don't think about it too much because they know they're probably not going to feel baby move when they're 6 weeks pregnant, right? So around 16 weeks, people oftentimes have these questions. And what do you do unless you're about to walk into your appointment with your OB? You're going to look it up. You're going to ask around. Likely, you're going to find some conflicting information, all right? There's a lot of information out there. You find conflicting information, and then you wonder what you can trust and what source is right, and you second guess, and you worry you're missing something. Stress. But what I've been able to do, because we know what this stress load looks like, is if we can predict it, we can prevent it. So at 15 weeks, we say, hey, you get an email. Why don't you log on to Sterling Parents and watch this video all about baby's movement? And then we are talking about when you expect movement, what it feels like, what's normal versus abnormal. So you have all of these questions, all of these concerns addressed before they ever get added to your stress load. That's one example. Another example is gestational diabetes. One of the most common sources of stress in pregnancy is the gestational diabetes screen. So what do? Of course, we provide the answers before you ever have the questions. Dr. Sterling just wanted to let you know that the video on gestational diabetes and the pregnancy course was so helpful. My 1-hour test came back elevated, had to go in for the 3-hour test. Without your video, I would have been so nervous, but seeing all the data, knowing what to expect and what numbers were involved made me feel informed and more relaxed going into it. This is the power of mapping out the stress load of pregnancy and then specifically creating content to address it and prevent it. And this is exactly why I created Sterling Parents. Take the entire stress load of the reproductive journey, trying to conceive, pregnancy, the entire first year postpartum, all of these predictable struggles that people have, create content, create education that addresses those questions and concerns before you get there. And we have it's not just pregnancy content, it's everything that you need, your birth classes, everything that you need for birth, everything that you need to prepare for postpartum and for baby, okay? So we have classes from board certified pediatricians, from international board certified lactation consultants, preparing you for breastfeeding, helping you navigate breastfeeding, all of the answers that you need to prevent the stress load. Because the fact that this meme is one of the most popular parenting memes is ridiculous, right? Handing over a 2-day-old baby with no instruction manual. So many of the worries that new parents have, the concerns that they have, are predictable. So many of the struggles are predictable. We can predict it. We can prevent it. We can provide education on the umbilical stump and the weird stuff that newborn skin does. All of that stuff can be prevented. So this meme is not something that members of Sterling Parents relate to. They don't get it because they were given an instruction manual. And in addition to, all of the courses that we have, and I'm not even touching on all of them, it's just a small percentage of what we have an incredible resource library database that replaces Google, YouTube, Reddit, any of the other search engines you're using to get your questions answered. And the beautiful thing about this resource library is it's 3E verified. So every single piece of information that goes into that resource library is evidence-based, it's expert-based, so it's taught by an expert, and it's experience-based. So all of the people who create content for this resource library are experts, and they are moms who've been there, who've gone through pregnancy, who've had kids, they've done it, right? So the truth is that you shouldn't have to worry about reducing your pregnancy stress. That is my job, and I would love to do it for you. Click the link and feel the immediate relief of knowing that you do not have to carry this weight on your own. This is my life's purpose. This is why I'm here. Let me help you, okay? We have a 30-day risk-free guarantee. We are here to help people who need us. If you get into the membership and you're like, this isn't really for me, no hard feelings. We really want to help the right people, okay? So this link that we have here, by the way, sometimes has surprise discounts on our Essentials Plus support membership. We also have a premium support membership that comes with one-on-one messaging with me. That membership is of course capped. I can't support everybody with one-on-one messaging. But if there is a spot available for premium support after you sign up, you will be prompted to upgrade if you want to. You don't have to, of course. So I would absolutely love to welcome you into our community to help you experience what a fully supported pregnancy and postpartum feels like. It's amazing. And I will talk to you soon because I'm going to be dropping into your inbox with some more stress reduction tips in the coming days. I hope that you will click the link, feel the relief of becoming a member of Sterling Parents, and allow me to help you carry this load. All right, until next time.